Hello and welcome to Newswatch, where we're going to be discussing the devastating effects of the gag rule. And joining me in studio is Vanessa Rios from the International Women's Health Coalition. Welcome, Vanessa. And as well as Jade Maina from TICAH in Kenya. So, Vanessa, you have been a part of a study that has shown the direct impact that the gag rule has had on women's sexual and reproductive rights all around the world. Please tell us some of the highlights.
Yes, the International Women's Health Coalition has been documenting the impacts of the global gag rule, also known as the Mexico City policy, for the past 2 years. We've been doing this in partnership with organizations in Kenya like TICAH, and also in South Africa, Nigeria, and Nepal. In these past 2 years, we've conducted 170 interviews. And what we have found is that there is irrefutable evidence that this policy is depriving women, girls, and other marginalized populations of essential health services and information that they need for their health.
And what about you, Jade? Have you seen this impact on the ground in Kenya? What have been the effects of the gag rule?
So, as part of one of the organizations that has been partnering with IWHC to collect the information, what we are seeing on the ground is that in the first year, there was, first of all, a chilling effect. And some organizations, even before they signed on to, stopped providing services. We have seen shutdown of health facilities. We have seen sort of regression of the services that women and girls are able to provide or access. For example, a health facility that used to provide free services for adolescent girls is now no longer able to provide these services for free. And marginalized women, rural women, poor women, and young girls living in slums are not able to afford these services when they are for pay. What that means is that they're not able to afford or access health services that are of high quality. It ends up pushing women to the back street, and this definitely leads to deaths and the rise in maternal mortality. The other thing that we are also seeing is um, the fragmentation of health services. Before, services were comprehensive, and there was the push to have comprehensive centers for HIV, contraception, or reproductive health services under one roof. But when you start to say some services cannot be accessed in some centers, what that means is that people need to go to more than one place to access services. In places where health facilities are very few, it means longer distance to walk or higher amounts of transport to pay, which definitely disenfranchises people of low income.
And we're talking about contraception in particular. So the gag rule has some effects on that. Can you tell us specifically how, in your research, Vanessa, access to contraception has been compromised by the gag rule?
Absolutely. So, oftentimes, this policy claims to target abortion services, but what we know, as Jade just mentioned, is that they're not provided in an isolated clinic. Oftentimes, the same providers that provide information about something like abortion are the same ones that provide comprehensive information and services for sexual and reproductive health. So when you close down a clinic or you defund an organization that provides comprehensive services, it's not just abortion that is affected. It's contraceptive services that are affected, HIV services, services for pregnant people, antenatal care services, and even we have a partner in Kisumu in remote Kenya where they're supporting a network of independent providers. In some of these communities, they're the only providers for hundreds of miles. So when you stop supporting a clinic like that, they're faced with a choice that no one should really have to make. It's, do we continue providing HIV, malaria, TB services in this community and know that we're leaving out information that can save women's lives?
Right.
Or do we continue providing comprehensive services, but without any funding.
But now the irony of all of this is that if you take away women's choices when it comes to contraception, you actually increase the number of unplanned pregnancies, which also means that there's further need for actually more abortions and not less. Meanwhile, this law is supposed to protect these rights of for abortion. And have you seen the effect of that in Kenya for yourself, Jade?
Yes, so this is the irony of this policy because it actually heightens what it purports to try and reduce. It heightens the number of need for abortions because with increased unmet need for contraception, then there is definitely increase in unwanted pregnancies. One example is Mary Stopes in Kenya was just about to sign a contract for a grant with the US government. For this reason, they were unable to sign this, and they from their own statistics and their own records, it shows that thousands and thousands of women will not have access to contraception from the Marie Stopes facilities that were going to access this due to this rule. Very recently, we've just been having conversations with reproductive health providers in Kenya, and what they're saying is that there's a complete shortage of reproductive health commodities, especially contraception commodities. So we are facing a crisis right now.
And when it comes to sex workers in particular and more indigent, because really women who have money somehow are able to circumvent a lot of these situations. If you live in a country where abortion is not legal, you can cross a border to one that is. But sex workers and indigent women, you have seen a direct proportion where there's been a rise in deaths, maternal deaths, in women coming in with really complicated issues of unsafe abortions. So would you say that obviously, like in poor women and marginalized women bear the brunt of this rule?
Yes, I want to say that. Oh, sorry. Go ahead, Jade.
So I would say definitely this has affected especially sex worker organizing. Like just as Vanessa was saying, organizations are faced with the moral conflict of choosing to sign on to a rule because a huge percentage of their grant comes from US government funding, and for that reason, they get gagged. So a group of sex worker organizations in Kenya have had to sign on to the gag rule. One of them really big, and it was in partnership with service providers who provided abortion, and they did do referrals, but now they're not able to do that. Another sex worker organization that we also partner with just recently told us that they conducted their own survey, and they find out that of all sex worker deaths, unsafe abortion is the leading cause of deaths of sex workers. From their findings, 35 women die each month out of unsafe abortions. They are really concerned, and from being gagged and them not being able to do proper referrals or proper training, it is causing devastating effects.
It's 35 women too many, in particular. Vanessa, you wanted to add on to that?
Yes, I just wanted to say that the problem with this policy is that it's based in ideology and it's not based in evidence. So we know from previous versions of the policy, when it affected even a much smaller pot of funding, that it caused increases in unsafe abortion because it really limited people's access to contraceptive methods. There's evidence that this happened in sub-Saharan Africa and also in Latin America. And so while the policy, according to the Trump administration, is called Protecting Life and Global Health Assistance, we know that that is absolutely false. It does the exact opposite of that. And another thing that the policy is doing is that it's emboldening right-wing and regressive actors in these countries to continue to make policy and to continue to act in a way that is not evidence-based and prioritizes ideology over the health and the lives of women and girls.
And what ideology does, because it's based on religion and sometimes culture, then it stigmatizes women because then you're seen as, you stigmatize yourself and you're stigmatized by the community. How much of a problem is stigma, particularly in your research. Stigma keeps coming up where sex and sexuality are concerned. Has there been an increase in stigma because this is so much based on ideology?
Right. Um, we haven't measured stigma itself, so I can't say that there has been an increase in stigma. However, I do think that this is a policy that's exacerbating already existing stigmas around abortion and around sexual and reproductive health services
Right,
more broadly.
right.
Absolutely.
And
I'd
Jade?
like to add on the issue of the emboldening anti-choice. So, in our context, what we are seeing is that in the last 1.5 years, there has been an increase in opposition and the steps that they're taking. We have seen several petitions against reproductive health providers and against leaders who have stood up and supported access to services. Recently, towards the end of 2018, we saw a petition that asked the Board of Medical Services to put a ban on Maristops Kenya from providing all services related to abortion, including life-saving services, including post-abortion care. There was an uproar that led to the reversal of that ban, but immediately after, we have seen marches on the streets to ask for abortion to close, abortion clinics to close. We have seen people picketing in front of reproductive health care clinics. We saw in the beginning of this year billboards with very stigmatizing information like abortion is murder, that definitely leads to a stigmatizing feeling for women who have needed and accessed abortion services.
Absolutely.
Is there anything good that has come out of the gag rule, Vanessa? Maybe there's some unintended consequences. Maybe there's some positivity. Is there anything that is positive that has come out of this rule?
I think that this is such an egregious overstep by the US government. This policy applies regardless of the national laws, and two of our project countries, Nepal and South Africa, they have very progressive abortion laws where it comes into direct conflict.
Right.
So I think just acknowledging that and this documentation of the very serious harms that the policy is doing have kind of are waking people up in some ways.
Right.
So I think there's definitely a call for unity. Now the policy is affecting not only organizations that
Right.
are working directly on sexual and reproductive health, but it's also applying to so many organizations that it never has before.
Right.
And they're realizing, the burden of complying with this policy, how harmful it is when they're not able to provide
Right.
evidence and information to their clients. And I do think in some ways it is bringing people together to acknowledge that it's wrong and to call for their local governments to be more responsible for ensuring the health of its people.
And what about in Kenya? Do you find that with health workers, for example, who provide abortion services, is there a particular target aimed at them? So to do not provide the services?
So what we are seeing is that when immediately after the gag rule was signed, the there were health providers, especially private health providers, who started facing harassment from police. What this has meant is that when they face harassment or they feel insecure about or they're afraid of their own security, one, they will probably shy away from providing services even when they could, or when they do provide the services become very expensive because then for their own security, and sometimes the police, what they do is extortion.
Right.
And this definitely drives the services to be much less accessible. So there is definitely like you're saying, what could be the good that comes out of this? I feel that there's a conversation happening right now about abortion within the country, and people are voicing their frustrations, but also voicing the conversation is starting and the conversation is happening about women's rights and women's health. And this is getting to the point where people are asking of the government to increase the budgetary allocation to health so that the country is not so much dependent on donor budgets that then a policy like this that's happening miles away from my country is affecting the woman living in Kenya right now.
We
Yes.
can see with states like Alabama and Georgia that the United States is really taking this seriously and
Absolutely.
wanting to reverse the rights of abortion legislation all around the world. What happens now? How? And it would appear that we may have taken it for granted for countries, for example, where abortion is legal. How do we move forward, Vanessa, and how do we mobilize in order to try and circumvent some of the effects of the gag rule?
Yes, I think the only solution is to end this policy, frankly. That's the only thing that will really solve all of these problems. To go back to your previous questions, I think there are other foreign governments that have tried to step up, that have tried to fill gaps. There was an announcement this week from Trudeau that he would increase Canada's funding for sexual and reproductive health
Right.
and women's rights, and I think that's really wonderful. At the same time, the US is the largest funder of global health in the world, and its contributions are about half of the global health assistance worldwide. So anything that we do outside of that will be helpful, but it won't be enough. And we really need to make sure that we end this policy. How we're working towards that is by documenting what's going on. We're not the only group that is doing this documentation.
Right.
We're a part of a whole group of organizations that are working to do different kinds of qualitative and quantitative documentations of the impact. We want to build the base of evidence, and we want to build the base of support, especially with our legislators, so that we can pass a policy such as the Global Her Act, which is on the table in the US right now. And that would make it so that the gag rule would be ended immediately, and it would make it so that future US presidents
Right.
could not apply this policy again with the stroke of a pen.
Mm. And what about social mobilization? Is there an opportunity at this point to better fortify the messages so that we amplify it and people, women, don't feel isolated within themselves to feel like maybe I'm the only person with this particular opinion? How can we mobilize socially to have a bigger impact?
So the one thing that we are trying to do in Kenya is to work with other civil society organizations to clarify the messages out there, especially to clarify the misinformation that's being put out by opposition organizations and individuals, and also providing spaces like hotlines where women and girls can call, can access the correct information, can get referred to services where they're available, and just get support on the other end of the line. But also, we would like to build a critical mass of women who stand up and demand for their rights, as our constitution currently is providing for abortion under if the health or the life of the mother is in danger, and also the Sexual Offences Act provides for abortion in cases of rape, incest. So we would like that this information is available and is clear, and slowly we do think that we can reduce the levels of stigma and increase the level of access for services.
Vanessa, what would you be in terms of like the research that your organization, International Women's Health Coalition, has done into the future? You know, what is the ideal situation where that you want to build for women? Absolutely, remove the gag rule,
Yes.
but clearly that's not just enough. You know, I look at a country like South Africa where it is legal, and yet 50% of all abortions in South Africa being illegal. So how is it that we move forward addressing not just legislation that is problematic, but general attitudes in order to for women to feel more emboldened to take action and to have body autonomy?
Yes, absolutely. So this documentation work is one small part of what IWHC does. I'm really lucky to work at an organization that not only does this kind of documentation, but we do our own advocacy, not only with the US government, but in high-level political fora like the UN, like the World Health Association. And we work with amazing partners like TICAH, with our partners in Nigeria, Nepal, South Africa, and throughout the world, so that we can learn from each other, we can speak together, we can go and advocate in the places that are accessible to us
Right.
so that we can move advance sexual and reproductive health and rights
Right.
globally
Right.
and together.
Right. Jade, any closing comments from you about how you'd like to move forward into the future?
I think into the future, we'd like to see that no woman dies out of unsafe abortions. Deaths from abortion are completely preventable by through the increasing access to contraception services and increasing access to safe abortion. We are doing all we can to increase the grounds for which women can access abortion through advocacy with our own governments and our county governments. Currently in Kenya, health is devolved. We are seeing lots of progress with some counties developing their own bills and acts on health that are even giving much more ground than just what the constitution is providing. So working on the ground, working with grassroots women, and raising our voice upwards to effect policy change that responds to the women's needs in Kenya. We'd like to see that the power of safe abortion is or other all reproductive health services is placed where it belongs in women's hands.
Without a doubt. And Vanessa, what about from you? Any closing comments?
Um,
Or did Jade cover it all?
I mean, that was just a really powerful statement. I think absolutely the power belongs in women's hands. We all need to have our own autonomy and to be trusted that we know what's best for us and to be given the power to take care of ourselves.
Vanessa Rios from International Women's Health Coalition and Jade Maina from TICAH in Kenya. Thank you so much for joining me.
Thank you.
And that's it for this particular segment. Thank you very much for joining us.